good representative from Norridgewock, who's actually birthed both of my children at my local hospital in Skowhegan, so it is quite an honor to stand. I think how fortunate I am as well, through the years, to have been through some bumpy medical experiences in my own family, and to be fortunate to have insurance. I guess I can thank the great people of the state of Maine for that, and I feel how fortunate most of us are to have great insurance. So I rise today to speak in favor of the pending motion, and really look at it and listen to some of the discussion and debate tonight. And I think of the good people in Somerset County. I think of what a big difference this will make in their lives. You know, we're talking about $12.9 million. That's a lot of money when you think about Somerset County. We're talking about over 3,500 people that are in need of health insurance that will probably receive it if we go forward with this. I also rise because I'm very excited. No one tonight has actually spoke of the parts in this bill and the parts that were in the other bill as well in regards to the drinking water projects and the wastewater treatment projects. So we've heard a lot tonight that this has nothing to do with this, that, or the other. But guess what? There's a lot more in this bill, and there was other parts in the other bills as well. I think tonight of places like Cary Medical Center, Calais Regional Hospital, Mayo Regional Hospital, Northern Maine Medical, Franklin Memorial Hospital, who, geez, that's been in the paper all the time talking about charity care. I think of my own hospital, Reddington Fairview. I think of the times I spent when my children were born there. With my first child, we were there over a week. We were fortunate enough to have insurance, which is actually pretty rare at Reddington. I think of what a wonderful time we had. It's a critical access hospital like many of your hospitals in your communities. I think of Waldo County General Hospital. It's a great little hospital. I think of, earlier there was a question, you know, thinking about our children, our grandchildren, our grandparents. I often think of the teachings of my grandmother. We talk a lot about morality. My grandmother, she always had an extra seat at her table. It wasn't a lot of money, but they always managed to find a seat and feed other people who did not have the means to feed themselves. We always had family members at holiday times who brought somebody, who brought someone else. My aunt worked at the VA and typically brought someone home to enjoy Christmas with us. I think of those teachings. It's very interesting sitting here listening to the debate. We probably won't change anyone's mind, but to me this is a common sense measure. It addresses our hospital costs. It will lower health care costs for all Maine people. It helps our hospitals. The hospital in Skowhegan is a major employer. I have talked with my CEO. This will help our hospital. This will help our people, our economy. The members of this body have to decide. I've already decided what's important to me, and I'll be voting my district. I'll be setting the politics aside. I'll be voting my district. You folks will have to decide what's more important, doing what's right for your district or doing what's right for the chief executive. The choice is clear to me, and I hope the choice is clear to you.
Objection,